another is the slave. And this master robot, it has got one console also. So the doctor is going to sit with the master robot and the console, and the actual operation will be carried out by the slave robot. And this particular slave robot is going to carry all the instruments which are required for carrying out the operations. For example, scissors, knives, needle, those things will be carried by the slave robot. And this particular slave robot is equipped with some sort of force sensor, some sort of torque sensor, so that it can measure how much is the torque, how much is the force required. For example, if the slave robot is going to use the knife, so this robot will have to put some force. If it is going to use scissor, there must be some torque requirement. So those things are to be provided. But before that, there is another very difficult problem which I have not yet discussed, which I am going to tell you. Now, all of us will know that during the surgery, a surgeon performs a set of activities in a particular predefined sequence. Now, before the slave robot is going to carry out that particular operation, the tip of this particular slave robot will have to reach that particular point. This is one problem. Might be the tip of this particular manipulator will have to follow or trace some straight line, or will have to follow some curved line.
So the patient, they keep sending you these videos and they keep saying, "Ek bahut jodi na shesh hoy." And they have miles to walk, and they keep walking. They show how they walk. The gratification of doing surgery is not about somebody just saying that "Amar operation hoyeche ami haঁটতে পারছি." The gratification of surgery today is telling us that I can walk 10 kilometers or 4 kilometers. I can go and play doubles tennis matches. I can go and swim. And I can go with my grandchildren or my children and travel and climb mountains also. So people living in Sikkim and Darjeeling, they come down because they have the places where they want. And the precision of 2 millimeters makes a difference. And that is what we can define with the technology which you have available. So technology improves you. It cannot replace the human hand and brain. Human hand and brain is there to feed the technology and information. Technology is there to correct the human hand and brain, which is actually going to give you consistently good results. And that is what the synergy of human hand and robotics is all about. So, these are the things. It's an aid to surgeon skill. Choose whichever system suits you. Associated pros and cons. Surgeon is a master and not the report. Well, I think I'll skip this. So thank you so much. I think these were the basic things about orthopedic robotic surgery. We have some on display on this side, and I welcome all of you. And again, thank you so much for the generic talk about the robotics, which we probably needed to know also about how these machines function, which we make them function so well. Thank you so much.
Thank you so much, sir. He is enabling greater precision and improved patient outcomes in women's health care. May I invite Dr. Rorunamu Roy, HOD and Senior Consultant, Gynecology Oncology, to share his insights.
Good afternoon, everyone. It's been a long array of lectures, so I will keep it short, sweet, and simple. First of all, thanks to Manipal Hospitals, the entire branding, marketing team, and all the members of the fourth pillar of our constitution, the media house, who is sitting here, and our patients who has come here to support us for this event today. So, I will disagree with what Dr. Shaurav said, that robotic surgery is future. Robotic surgery is not future, it's already present. It's very much present. And for gynecology, the surgical robot got FDA approval or the US authority approval in 2005. There has been 20 years of gynae robotic surgery. So robotic surgery is not the future, it's already present. And robotic surgery is not about, replacing the surgeon. It is about
their normal lives in 15-20 days. So with Solving cluster getting in the robots in a few days time, what we can give to our patients is life free of fear of dying anytime. Yes, CABGs prevents a person from dying suddenly. That we know. But people live with the disease because of the size of incisions. So the robotic surgery, what it will do is, it will be a surgery without any cut, small holes on the chest, heals quickly, patient back to their life doing all the activities. So thank you the Manipal management team for getting in the robot to the Solving cluster, and I think the patients will get a lot of benefit out of it. Thank you.
Resolution means what is the least count? Least count of the resolution on which the precision depends.
I mean, minimum how much can you see?
How,
Zero
how
millimeter.
is it zero?
We can go up to, very rarely we will have less than 1. Because it is not desirable, sir. It becomes very stiff.
It is very near to zero, but not zero.
We should not make it 0 because it becomes very stiff. We should leave it at 1 to 2 millimeters, which is the ideal optimum. It can go up to 3 millimeters to keep it nice and mobile and flexible. Because ligaments, they need certain flexibility in a range of.
How technology can empower medical professionals by enhancing precision, improving patient outcome, and enabling minimally invasive procedures. As someone working in the field of AI, I strongly believe that the future of healthcare lies in the collaboration between medicine and technology. AI and robotics are not here to replace clinicians, it's just to assist clinicians such that they can handle the operations ethically and in a better way. The performance can be more accurate and recovery can be faster. While technology continues to evolve, we must remember that ethics, compassion, and human judgment remain at the heart of healthcare innovation, and it should thus serve humanity and improve the quality of life for patients. We do not intend to replace the human surgeons or medical practitioners, but it is to assist them when maybe in a remote location or maybe to provide a better outcome.
AI defeat nature and vice versa. So what I did, I designed some example. With the help of that particular example, I tried to find out the difference between the HI and AI. Let me take the same example.
They have laparoscopic scan. And the way I see it, all hospitals will have at least one, maybe more robotic stacks in their hospital. And more we use it, it will be more cost effective. The cost will come down as well. So we are very hopeful to start our robotic program in.
If I enumerate them, first of all, the biggest advantage is our hands movement. Our hands are big enough and it cannot reach every part of our body easily. Like I can see Dr. Arunavo, Dr. Shuman, Dr. Arunansu, Dr. Abhay are there. They work in the, Dr. Arunavo, Abhay, they work in the pelvic region, that is lower part of our abdomen. And if you see, there is a bone, you can feel, which we call hip bone, which is surrounding the area. So entering in this, especially posterior or in the deep part of this region, if we try to enter our hand, it's difficult. We have to make a huge incision. We have to